Hey guys, have you or someone that you know been diagnosed with acid reflux? We used to call this heartburn, right? It's now gastroesophageal reflux disease, GERD. And as a practicing physician assistant, I see pretty much most of my patients on anti-reflux medications. Now, today's video is specifically on the class of drugs known as proton pump inhibitors. These are PPIs for short, and what these do is they decrease the production of acid in your stomach, and they are ultra effective. They decrease the production of acid by like 99%. So, are you or someone that you know taking, let's see, Prilosec, Prevacid, Nexium, Protonix, all of these drugs, those are the trade names. The generic names end in azole, so omeprazole, pantoprazole. If you're taking one of these drugs, please just listen in, okay? So first of all, are these drugs safe? Guys, they're safe for the short term. These drugs were approved by the FDA for 2 to 6 weeks in length. You know, in some indications, you can take them for up to 12 weeks, but I want to talk about long-term risk associated with these, okay? So acid reflux, right? Like the acid needs to be in our stomachs, okay? It only becomes problematic when the acid refluxes up into the esophagus, the food tube. Then you feel that burning sensation, okay? A lot of times, patients are being put on these medications without any indication to do so. So first of all, check with your primary care provider. I am not giving you medical advice. I'm simply providing you with some education that I hope that you find helpful and that you'll share with others who you think might find it helpful as well. And if you haven't subscribed to my channel, please think about doing so. It really is, as a medical professional in emergency medicine, my goal to help you bridge that gap between modern and alternative medicine and help you to think about things that you might not have thought about in the past. Okay, so anyways, these drugs, why are they problematic over the long term? Well, guys, again, if we don't have production of acid in our stomachs, this can decrease our immune system. So there have been links associated with increased amounts of pneumonia and other bacterial conditions because our gut isn't able to do what it does naturally, right? Like I love sushi. If you go to a sushi restaurant and there's some microbes in the sushi, my gut's gonna kill those microbes. Yours isn't. Unfortunately, you might get sick, which might progress to colitis. You might also get something called SIBO, small intestines, bacterial overgrowth. This is problematic. The other problem when we decrease acid production in our gut is we lack the absorption of several very important nutrients. Okay, one of those is calcium. Okay, so there is a link between long-term use of PPIs and bone health, specifically hip fractures. And I will put a study showing this in the comments below so that you too can read the science behind this. So we know that there's a link between long-term PPI use and fracture risk, okay? Also, magnesium. Guys, magnesium is needed for so many processes in our body. If you haven't seen my video on why magnesium is so important, please check that out. But long-term PPI use leads to decreased absorption of magnesium. Also leads to decreased absorption of B12. So B12 is needed for many things as well, but if you're feeling tired, lazy, without any energy, you might have low vitamin B12 levels. Now, we need intrinsic factor to absorb B12, which is why we have a difficult time doing such when the acid in our stomach is decreased, okay? So also, long-term studies are showing that it's affecting renal function and even leading to kidney failure, as well as increasing risk for heart attack and for dementia. Okay, so again, in the short term, these are okay and they are safe. But if this medicine is still on your medicine list, because I'm seeing it, like I said, on most patients' medicine lists, they're not only taking this once a day, oftentimes they're taking it twice a day. So again, check with your primary care provider. What can you do about it? Okay, first of all, you can tweak your diet, right? Like we know that there are certain things that irritate GERD. Okay, so chocolate, sadly, is one of them. Alcohol, eating late at night. So you shouldn't be eating right before going to bed because this can cause acid to reflux up into the esophagus. Sometimes I'll even recommend to patients that they elevate the head of their bed on cinder blocks so that that acid doesn't reflux at night when they're laying flat. But you need to tweak your diet. And there's actually been some studies linking high carbohydrate diets to more symptoms in GERD patients specifically. So think about that. So if you tweak your diet and you're still symptomatic, or if you're on a PPI currently and you want to get off of it, firstly, you can't just go cold turkey. If you do this, you could experience a rebound effect. And if you're taking a PPI, again, this is like the master of all anti-acid medications. So you might need to decrease dose for a while, do a taper, and then even take something called an H2 blocker for a bit before discontinuing altogether. Again, talk to your PCP about tapering off of this if this is something that you're interested in doing. And thirdly, if you do these things, so if you make diet modifications, if you lose some weight so that you don't have abdominal obesity causing problems, and you're no longer taking the medication and you're still symptomatic, this is probably a time when modern medicine needs to intervene, and you might need an EGD, so a scope down your food tube, looking at your esophagus, looking at your stomach, looking at the first part of your small intestines, your duodenum, to make sure that there's no ulcer, mass, whatnot, okay? So there have been a few recommendations that I've found to be extremely helpful in my patients as they're weaning off their PPIs. One of them is put out by the Very Good Elixir Company. It's called Bitter's Belly Tonic. And I will put that in the comments below for a link to have you check it out if you're interested. And again, a good quality probiotic. So guys, again, modern medicine is absolutely amazing. It's done so many great things for us, but it's really important that we continue to educate ourselves and ask questions when we are in appointments with our PCPs to make sure that we're getting the best care for ourselves. Everyone's busy and we need to be advocates for ourselves. So please be sure to have these conversations with your PCP. I hope that you found this helpful. If you have, please, again, like it, subscribe to my channel, and share this with anyone and everyone that you think it could help. Thanks, guys. Have a good day.